biggest question I had about applying to university was how I was going to write my personal statement, and in particular how I was going to make it competitive, because knowing dentistry or dental therapy is very competitive, so I wanted to make my personal statement stand out from that of other candidates. One way in which I addressed this question was by watching YouTube videos. There are a lot of YouTube videos out there with students that have written dental or dental therapy or even medicine personal statements, and they give you tips and advice on what to do. In particular, I found it useful to have a strategy. So I know that one of my strategies was to write examples of where I had been in a team, because I know teamwork's important for dental therapy or dentistry, and I wrote examples of when I've been in a challenging situation, how I overcame that. I did mention some weaknesses on there, but in a way that I was capturing the fact that I wanted to now work on making my weaknesses a strength. As a current student, I can say that the points that my personal statement told me to mention are actually really important. As a dental therapy student and being integrated with BDS students, I know how important it is to have those teamwork skills. At the start of the year, of course, you don't really know anybody, so you have to make friends, and communication is very important, as we do a whole module on communication. And obviously manual dexterity is massively important, because when you start phantom head training and eventually clinics, manual dexterity is very, very important. So if you can mention that in your personal statement, that would really help you a lot, because you should have an example of how you're going to build that out prior to attending dental school. The biggest question I had about dental therapy was actually, how is it going to be different from dentistry? So I had this question because I had initially wanted to apply for dentistry, but then the preventive side of dental therapy drew me towards dental therapy. So one way I found out how they were going to be different or similar was by going on the Newcastle University website and looking at the module listings for both courses. I found that although dental therapy has some courses that are not the same as dentistry, of course, because dental therapy is for 3 years and dentistry is for 5 years, I did notice that they both had certain aspects in common, such as anatomy of the head and neck and clinical skills. As a current student, I've actually been able to witness that there is a lot of integration between dental students and dental therapy students. So for example, during the anatomy lectures, we are all together in one lecture, and during clinical skills, which I'm a part of currently, we are all together in one clinical simulation unit learning the exact same things. This is great because it allows postgraduate relationships to be built early, and it allows sharing of advice, and allows for the dental students and dental therapy students to feel on the same level, which is really nice. The biggest question I had about university study was how content heavy my course would be, and if I would remember how to take lecture notes. So I had this concern because despite having completed a previous degree, it was a while ago, so I didn't know if I'd remember how to take lecture notes. And also dental therapy, I knew was going to be a completely different ballgame. So one way I addressed these concerns was by talking to current students. So current students told me that they use an app called Quizlet to break down all the information that they needed to learn into small chunks that were easily accessible at any time. And they also said they made use of group study sessions. So as a current student, I've implemented both of these strategies. I made use of Quizlet when I was studying anatomy of the head and neck for my December exams, and I found it very useful to break down the information into small chunks and to have those flashcards ready to read on the coach home, for example. As well as this, I found group study sessions to be great. I used to be someone who worked independently, but at university I find the value of working with others. Group study sessions are great because they allow your friends to motivate you through the lectures, and also if you're unsure of anything or have any concerns, you can discuss this with them. The biggest question I had about living in Newcastle was how I'd be able to live so far away from home for many months at a time with complete strangers. So although I have previously attended university and lived in halls, my previous living situation meant that I was only 40 minutes away from home. So I was able to take the train and be home every weekend. As Newcastle is 6 hours away, I knew that that wasn't going to be an option. One way I figured out how current students were doing it was by chatting to them. So Newcastle University has a section on their website where they allow you to speak to current students. Luckily, the student I was speaking to was living away from home, quite far away. So I asked her what it was like and what the bedrooms were like, what the people were like. She said that their bedrooms were quite spacious, that depending on which accommodation you pick, you will be very close to campus and city centre and eateries and restaurants to go to. And she said that the people were very friendly in Newcastle as well. This put my mind at ease, and I can honestly say as a current student that she was right. The people are very friendly. I've made good friends with a lot of my flatmates. Everybody delegates chores, so it's all fair. And we have had many get-togethers as a flat, so we've had a Christmas dinner get-together, and we have many more planned. I had nothing to worry about, and neither do you. The biggest question I had about Newcastle University was how it ranked compared to other universities that I'd applied to. In particular, what was its Russell Group status, and what was its teaching like. So I had this question because I know that on graduation, employers are going to look at which university I went to. So I wanted to make sure that I was going to a competitive one. So the way in which I found out the answer to this question was by going onto the Newcastle University website. So the page in particular for my course that I was choosing. And I read on there that they had, modern facilities, world-class teaching, and also their Russell Group status was higher than the other universities I applied to. So being a current student, I can confirm actually this is all true. I actually experienced their clinical simulation unit during Phantom Head training, and it's fully equipped, very modern. I wouldn't say there's anything lacking from the clinical simulation unit. It's great. Also, the dental school is integrated within an actual dental hospital, which is nice because you see patients as you go up and down the list, and it means when we start clinics next year that we will not have to travel very far at all, because our clinics will be in the actual dental school that we're studying at the moment.